Welcome to our comprehensive guide on Nplate, an innovative medication used to treat low platelet counts in patients with chronic immune thrombocytopenia, ITP. In this article, we will delve into how Nplate works, its various uses, and potential side effects, providing you with all the essential information you need to know. Nplate, developed by Amgen, is a recombinant protein that mimics the body's natural thrombopoietin, TPO, a hormone responsible for stimulating platelet production. By increasing platelet production, Nplate helps restore normal platelet counts, reducing the risk of bleeding associated with ITP. As we explore the uses of Nplate, we will discuss its effectiveness in treating ITP in both adult and pediatric patients. Additionally, we will touch upon its off-label uses and any ongoing research involving Nplate's potential benefits in other conditions. Throughout this guide, we will also address potential side effects of Nplate, ranging from mild to severe, to give you a comprehensive understanding of its safety profile. Whether you're a patient curious about Nplate or a healthcare professional seeking information, this guide aims to provide you with a complete picture of Nplate's mechanism of action, its approved uses, and any precautions associated with its use. How does Nplate work? Nplate, developed by Amgen, is a revolutionary medication that effectively treats low platelet counts in patients with chronic immune thrombocytopenia, ITP. But how exactly does Nplate work its magic? Nplate is a recombinant protein that mimics the body's natural thrombopoietin, TPO, a hormone responsible for stimulating platelet production. In patients with ITP, their immune system mistakenly attacks and destroys platelets, leading to a decrease in platelet count and an increased risk of bleeding. Nplate works by binding to the same receptors as TPO in the bone marrow, stimulating the production of platelets. By increasing platelet production, Nplate helps restore normal platelet counts, reducing the risk of bleeding associated with ITP. This innovative medication provides a targeted approach to treating ITP, addressing the root cause of the condition and promoting platelet production. It's important to note that Nplate does not work as a quick fix. It typically takes a few weeks of treatment for patients to see an increase in platelet count. However, with continued use, Nplate has shown significant efficacy in maintaining platelet counts within a safe range. Medical conditions treated with Nplate. Nplate has been primarily approved for the treatment of chronic immune thrombocytopenia, ITP, in both adult and pediatric patients. ITP is a condition characterized by a low platelet count due to the immune system's destruction of platelets. In adult patients, Nplate is indicated for those who have had an insufficient response to corticosteroids, immunoglobulins, or splenectomy. It is important to note that Nplate should not be used as a first-line treatment for ITP, but rather as a second-line option for patients who have not responded well to conventional therapies. In pediatric patients aged 1 year and older, Nplate has been approved as a treatment for chronic ITP in those who have had an insufficient response to corticosteroids, immunoglobulins, or splenectomy. The use of Nplate in pediatric patients provides a much-needed treatment option for young individuals struggling with chronic ITP. While Nplate's primary use is in treating ITP, there are ongoing studies exploring its potential benefits in other medical conditions. These include aplastic anemia, myelodysplastic syndromes, and chemotherapy-induced thrombocytopenia. These studies aim to expand the scope of Nplate's applications and provide potentially life-changing treatment options for patients with various platelet-related disorders. Nplate dosage and administration. The dosage and administration of Nplate vary depending on factors such as the patient's age, weight, platelet count, and response to treatment. It is crucial to follow the prescribed dosage and administration instructions provided by the healthcare professional. For adult patients, the initial recommended dose of Nplate is determined based on the patient's platelet count. The dosage is adjusted every 1 to 2 weeks to maintain the platelet count within a target range. The healthcare professional will closely monitor the patient's response to treatment and adjust the dosage accordingly. In pediatric patients, the initial recommended dose of Nplate is also based on the patient's platelet count. Similar to adult patients, the dosage is adjusted every 1 to 2 weeks to maintain the platelet count within the desired range. Nplate is administered as a subcutaneous injection, meaning it is injected just below the skin using a small needle. The injections can be self-administered at home after proper training from a healthcare professional. However, it is essential to follow the specific instructions provided for the preparation and administration of Nplate to ensure safe and effective use. It is crucial not to change the dosage or administration of Nplate without consulting a healthcare professional. They will have the necessary expertise to determine the appropriate dosage and administration schedule based on the patient's individual needs and response to treatment. Potential side effects of Nplate. Like any medication, Nplate may cause side effects in some patients. It is important to be aware of these potential side effects and discuss them with a healthcare professional before starting treatment. Common side effects of Nplate include headache, fatigue, dizziness, nausea, muscle aches, and injection site reactions. These side effects are generally mild and transient, resolving on their own without any specific treatment. In some cases, Nplate may cause more severe side effects. These include blood clots, heart attacks, strokes, bleeding, and bone marrow problems. While these side effects are rare, it is essential to be vigilant and report any unusual symptoms to a healthcare professional immediately. It is worth mentioning that the benefits of Nplate in treating chronic ITP often outweigh the potential risks associated with its use. Healthcare professionals carefully weigh the risks and benefits of Nplate before prescribing it to patients, ensuring the best possible outcomes. Patients should not hesitate to discuss any concerns or questions about the potential side effects of Nplate with their healthcare professional. Open communication can help alleviate any anxiety and ensure the patient's safety and well-being throughout the treatment process. Precautions and contraindications for using Nplate. While Nplate is an effective treatment option for chronic ITP, there are certain precautions and contraindications that patients and healthcare professionals should be aware of. Nplate should not be used in patients with a known hypersensitivity to the medication or any of its components. It is crucial to disclose any allergies or sensitivities to medications to the healthcare professional before starting Nplate treatment. Patients with a history of blood clots or thrombotic events should exercise caution when considering Nplate. The risk of blood clots may increase with Nplate treatment, and close monitoring is necessary to ensure patient safety. Additionally, Nplate should not be used as a first-line treatment for ITP. It is intended for patients who have had an insufficient response to corticosteroids, immunoglobulins, or splenectomy. The healthcare professional will evaluate the patient's medical history and response to previous treatments before considering Nplate as a viable option. Pregnant or breastfeeding individuals should consult their healthcare professional before starting Nplate treatment. The potential risks and benefits of Nplate during pregnancy or breastfeeding need to be carefully assessed on a case-by-case basis. Overall, it is crucial to have open and transparent communication with a healthcare professional regarding any existing medical conditions, medications, or concerns before starting Nplate treatment. This ensures that the patient's specific needs and circumstances are taken into account, maximizing the potential benefits of Nplate while minimizing any potential risks. Nplate in pediatric patients. Chronic immune thrombocytopenia, ITP, can affect individuals of all ages, including children. Fortunately, Nplate has been approved for use in pediatric patients aged 1 year and older, providing a much-needed treatment option for young individuals with chronic ITP. The use of Nplate in pediatric patients follows similar principles and guidelines as in adult patients. The dosage and administration are adjusted based on the child's weight, platelet count, and response to treatment. Regular monitoring is essential to ensure the child's safety and well-being throughout the treatment process. Pediatric patients and their parents or caregivers should receive proper training from a healthcare professional on how to administer Nplate injections. This empowers them to take an active role in the child's treatment and ensures that the injections are administered correctly and safely. It is important to note that the safety and effectiveness of Nplate have been established in pediatric patients aged 1 year and older. There is limited data on the use of Nplate in children younger than 1 year, and therefore, its use in this age group should be carefully considered and discussed with a healthcare professional. Nplate in pediatric patients has shown promising results in maintaining platelet counts within the desired range, reducing the risk of bleeding, and improving the quality of life for young individuals struggling with chronic ITP. Ongoing research and studies continue to expand our understanding of Nplate's benefits and safety profile in pediatric patients. Patient testimonials and success stories with Nplate. Real-life experiences and testimonials from patients who have undergone Nplate treatment can provide valuable insights into its effectiveness and impact on their lives. Let's explore some of the success stories and positive outcomes associated with Nplate. Many patients with chronic immune thrombocytopenia, ITP, have reported significant improvements in their platelet counts and a reduced risk of bleeding after starting Nplate treatment. This positive response to treatment has allowed them to resume their daily activities without the constant fear of uncontrollable bleeding. Patients often describe a sense of relief and improved quality of life with Nplate. The ability to engage in physical activities, participate in social events, and enjoy life without the constant limitations imposed by low platelet counts has had a profound impact on their overall well-being. It is important to note that every patient's response to Nplate may vary, and individual experiences may differ. However, the consistent positive outcomes reported by many patients highlight the potential benefits of Nplate in managing chronic ITP and improving patients' quality of life. Patient testimonials serve as a reminder of the importance of seeking appropriate medical care and exploring treatment options like Nplate. By sharing their stories, patients create a supportive community and inspire others who may be facing similar challenges to take action and seek the help they need. Frequently asked questions about Nplate. As with any medication, there are often questions and concerns that arise regarding Nplate. Here are some frequently asked questions about Nplate and their respective answers. Can Nplate cure chronic immune thrombocytopenia, ITP? While Nplate is highly effective in managing chronic ITP and increasing platelet counts, it is not a cure for the condition. Nplate works by stimulating platelet production, thereby reducing the risk of bleeding associated with ITP. Continued treatment with Nplate is usually necessary to maintain stable platelet counts. How long does it take for Nplate to increase platelet counts? The time frame for Nplate to increase platelet counts varies from patient to patient. Some individuals may see an improvement within a few weeks, while others may take longer. It is essential to have regular follow-ups with a healthcare professional to monitor the response to Nplate treatment and adjust the dosage as needed. Are there any dietary restrictions while on Nplate? There are no specific dietary restrictions associated with Nplate. However, maintaining a well-balanced diet and a healthy lifestyle is important for overall well-being. It is always advisable to consult a healthcare professional or a registered dietitian for personalized dietary recommendations. Can Nplate be used in combination with other medications? Nplate can be used in combination with other medications as prescribed by a healthcare professional. It is crucial to inform the healthcare professional about any medications, supplements, or herbal remedies being taken to ensure there are no potential interactions or contraindications. These are just a few examples of the frequently asked questions about Nplate. Patients and healthcare professionals should engage in open communication to address any concerns or queries regarding Nplate treatment fully. This ensures that patients have a clear understanding of the medication and its effects, ultimately leading to better treatment outcomes. Conclusion and final thoughts. Nplate, an innovative medication developed by Amgen, has revolutionized the treatment of chronic immune thrombocytopenia, ITP. By mimicking the body's natural thrombopoietin, TPO, Nplate effectively stimulates platelet production, restoring normal platelet counts and reducing the risk of bleeding. Throughout this comprehensive guide, we have explored how Nplate works, its various uses, and potential side effects. Nplate provides a targeted approach to treating ITP, addressing the root cause of the condition and promoting platelet production. Nplate has been approved for use in both adult and pediatric patients with chronic ITP who have had an insufficient response to conventional therapies. The dosage and administration of Nplate are carefully adjusted based on individual patient factors, ensuring optimal treatment outcomes. While Nplate has shown significant efficacy in managing chronic ITP, it is essential to be aware of potential side effects and precautions associated with its use. Open communication with healthcare professionals and regular monitoring can help ensure patient safety and well-being throughout the treatment process. Patient testimonials and success stories highlight the positive impact of Nplate on individuals' lives, improving their platelet counts and overall quality of life. These stories serve as a reminder of the importance of seeking appropriate medical care and exploring innovative treatment options like Nplate. By providing a comprehensive understanding of Nplate's mechanism of action, its approved uses, and any precautions associated with its use, this guide aims to empower patients and healthcare professionals alike. With the right information, individuals can make informed decisions about their treatment options and take control of their health. In conclusion, Nplate offers hope and a brighter future for individuals with chronic ITP, providing a targeted and effective treatment option. As research and advancements continue, the potential benefits of Nplate may extend beyond ITP, offering new possibilities for patients with platelet-related disorders. Thanks for watching.